We include bioidentical hormone replacement therapy because it's an essential part in certain stages of our life when men and women start aging from 35 on. Traditional medicine doesn't really think about checking the hormone levels and incorporating that part. And usually the traditional workup is going to be to check the thyroid levels, make sure you don't have anemia, and roll out the basic medical. And so the whole picture, really including mental health and the hormone levels, is not even considered or even evaluated at all. So patients sent back feeling discouraged, being told your thyroid is normal and everything else is fine. And they're not even looking at the anti-aging factor, which is extremely significant starting from 35 up. Bioidentical hormones and hormone replacement can be very impactful and extremely life-changing. It is surprising with this day and age and the amount of years that regenerative and anti-aging medicine has been out, really how behind we are. I feel like as a community, we're pretty behind of the things that have been out on the market for 10 to 12 years and studied and actually do have an impact on how we feel. Patients are told all the time when they're 35 to 40, it's not possible, you're too young to be having any premenopause symptoms when the patients go in. And when they mention it to their primary care, they're told, no, you're too young for that. You don't have anything wrong. Go exercise a little bit more and eat a little bit healthier, and you should stop feeling that way. Patients will have low hormone levels that back in the 1950s and 60s, we wouldn't have seen those levels. But we have to remember there's a lot of toxins and environmental factors in our everyday life that do contribute to patients starting to experience those symptoms early. Personally, as I started approaching 40, started to feel extremely exhausted despite living a healthy lifestyle, exercising regularly. So when I tried the hormone replacement therapy, it was life-changing for me, and it sort of set off a light bulb to say, okay, I'm not going to just check patients' basic labs and tell them they feel okay when they're coming in and telling me that they don't feel okay. We have to be able to look at the whole picture, and that's kind of how this whole concept many years back, more than 5 years ago, started to formulate. It's always shocking to me how many patients still come in here and told they've repeatedly gone to appointments and reported their symptoms and been told, well, your thyroid is normal, you don't have anemia, there's nothing wrong with you. They're made to feel like their symptoms are not real. They come in here and we evaluate the hormones, and a lot of them opt for and trust the plan because they're just tired of feeling the way they feel. And when they come back to their follow-up appointment after doing this treatment, they're like a totally different person. And then that in itself leads to the loyalty and the referral to the patients, just because it changed their life the way it changed my life. And I feel like because I have been in that particular scenario and have been in their shoes, I can guide them effectively through that change in that individualized treatment plan. And it's proven in blood work. It's not something imaginary. It's something that we start with a baseline. We follow an evidence-based calculator, and then the patients, aside of feeling better, come back, and then we compare the hormone levels. Once we've optimized the hormones, then we just reach on maintaining them, and we start adding the other healthy lifestyle interventions that can be added, because now you have the energy. You're no longer fatigued, and so you have the energy to do the other things once these have been optimized. And there's the jumpstart of their entire health and wellness journey.